I'm going to talk to you about diarrhea in children. So diarrhea or gastroenteritis is a very common illness affecting children. So they present with loose stools, which can be very smelly and slimy. There can be some blood also in the stools of the babies. And also some of the babies develop vomiting, might develop a couple of times a day and look very lethargic and less active. And some of the babies or children can develop fever as well. So diarrheal illnesses are commonly due to viral infection, but sometimes this could be due to bacterial infections as well. So why are we worried about diarrheal illnesses in childhood? This is because two important complications can happen if we don't manage the child properly. What you need to remember is that children are at higher risk of developing dehydration. That is, the water amount of their body can go down into very dangerous levels when they keep on having loose stools and vomiting. And also we need to remember, during any illness, a child can reduce the intake of fluid and also reduce taking food. So all this will reduce the hydration level of the child, so the child can get dehydrated. And the other risk, which is again a very concerning risk, is that the child can lose a lot of salt along with the vomiting and the diarrhea. So this can lead to low sodium levels in the child's blood, which can be very serious. So as a parent, what can you do when a child is having gastroenteritis or a diarrheal illness? So the main thing is to make sure that your child is well hydrated. So please don't restrict the fluids or food you are giving to the child. But we need to make sure, if the child is refusing food, there's a minimum amount of fluid that every child needs per hour, and your doctor is able to tell you that volume. That obviously depends on the weight and the age of the child. So you have to make sure that at least that minimum amount of fluid is going on to the child on regular basis to make sure that the child is maintaining the hydration really well. And what type of food can you give? So all the regular food you can offer to the child, and if your baby is breastfeeding, please continue breastfeeding. If the baby is on any formula milk, doesn't matter, continue with that also. Give it with the same strength. Don't make any diluted milk. And a very good fluid to be given for children with diarrhea and vomiting is oral rehydration solution. We commonly know this as Jeevani, which is very widely available in our pharmacies. So this is a very good fluid that you can give to your child to prevent dehydration. And also there are many other options if your child is not a great fan of Jeevani. You can give him coconut water and also fruit juices. At the same time you can offer some soup to the child. So like giving a variety of liquids and also food types that the child likes, you can make the hydration of the child really well. You should also remember that one must avoid giving just water because it lacks salt, and there's again that risk of your child going into low sodium levels that we have discussed before. Sometimes we see that due to ongoing vomiting and also refusal to feed, children get dehydrated, in which case we might have to even admit your child to give some saline via a cannula inserted to an arm or leg. So that is very uncommon, not a very common scenario. If you are able to maintain the child's hydration level at home, we can always manage your child at home with oral fluids. What can you give the child to eat? So your regular food can be offered to the child, rice and curries, even a bread, toast, anything that the child likes can be offered. But we have to make sure, child might not like to take lots and lots of food, so offer the quantities that the child can tolerate. Go slow and have patience with your child. What are the warning signs? So mainly these are the signs of dehydration. So the first thing your child would do would be to go down in the volume of urine that the child produces. So if you are noticing that your child is not urinating as frequently as previously and the volume is getting lesser and lesser, you might also note that the concentration of the urine is also getting worse. Like a normal child would pass urine about 6 to 8 times a day in good quantities, and would be like light yellow or water-like. But when your child is dehydrated, the number of times the child passes urine goes down, maybe 2-3 times a day. They look very dark and like plain tea color, so that is not a good sign. You need to immediately take the child to a hospital. And the other warning sign would be the child looking very less active, lethargic, and not interested in any food or any drinks. Then that is again a warning sign. Child might be having dehydration or even low sugar levels or low sodium levels. So immediately you need to see your doctor. And again, if you feel like the child's eyes are very dry and the mouth is very dry and no tears are coming and might even have some sunken eyes, so that's a very serious sign. Again, you need to take your child to a doctor very soon. So when you have to summarize, so diarrheal illnesses are very common these days, commonly due to viral illnesses. The main problem is children do get dehydrated very quickly. So the main concern is to maintain their hydration. Please make sure your child is getting assessed by your doctor, and your doctor will be able to tell you the minimum amount of fluids your child needs to take. Please avoid taking unnecessary antibiotics unless prescribed by your doctor, because most of the time antibiotics are not going to be helpful for your child, because this is mostly due to viral illnesses.